Good morning, everyone. We are going to study about the drug Dapagliflozin, and here in this video, we will discuss about its introduction, pharmacokinetic, pharmacodynamics, clinical uses, dosing, toxicity, adverse effects, side effects, and contraindications. So, starting from the introduction of Dapagliflozin, Dapagliflozin is a drug which is used to treat diabetes type 2. It lowers the blood sugar by reducing extra glucose through urine. It is also used in heart failure and kidney diseases. What is diabetes? We can classify diabetes into two types, in which type 1 is that where body doesn't produce the sufficient insulin, while in type 2, body produces insulin, but our body cell get resistant to the insulin. They don't allow the glucose to enter into them and perform their functions. Next one is physical and chemical properties of dapagliflozin. The molecular weight of dapagliflozin is 408.87 gram per mole. In powder form, it is white to off-white color. Its melting point is 110 to 115 degrees Celsius. It is fairly soluble in alcohol while poorly soluble in water. Our next purpose is to learn about the pharmacokinetic of the dapagliflozin. So starting from the absorption, when dapagliflozin is administered through the oral route, it get absorbed into our bloodstream. Its bioavailability is 78%. For its better understanding, let's suppose a person consume a dapagliflozin tablet of 10 milligram. The drug which will get absorbed in its bloodstream will be 7.8 milligram, and its absorption is also affected by the presence of food in the stomach. Our next subtopic is distribution. How dapagliflozin is distributed in our body. Dapagliflozin has the 91% protein binding, and its protein binding is not disturbed in patients with the renal or hepatic impairment. Moving to the metabolism, dapagliflozin is metabolized by the two pathways. In one pathway, it is metabolized by the cytochrome, while in the second pathway, it is metabolized by the glucuronide transferase enzyme. The second pathway, glucuronide transferase enzyme, is the major pathway, and most of the dapagliflozin is metabolized by this pathway. This enzyme converts the dapagliflozin into dapagliflozin 3-orthoglucuronide. Moving to the elimination after the metabolism, after 75% of the total radioactivity is removed in the urine, while the 21% is removed in the feces. The half-life of the dapagliflozin in our blood is 12.9 to 13 hours. Moving to the pharmacodynamic. So, mechanism of action of dapagliflozin is that it is a selective inhibitor of the sodium glucose transporter 2, cotransporter 2. SGLT2 expressed in the proximal renal tubule is responsible for the majority of the glucose reabsorption from the tubular lumen. Dapagliflozin as inhibitor attaches to this receptor and blocks the reabsorption of glucose. Now moving to the clinical uses. Dapagliflozin is used for the treatment of type 2 diabetes as monotherapy in adults when diet and exercise alone do not provide the adequate glycemic control. While in the diabetes type 1, it is also recommended as an adjunctive therapy where insulin is administered to facilitate the absorption of glucose in the cell, while the remaining present glucose is removed by the dapagliflozin from the blood. Now moving to the dosing, the dosage of dapagliflozin varies depending on the clinical condition. For adults with the type 2 diabetes mellitus, initial dose is given 5 mg. It is given by the oral tablets. During this dosing, proper exercise and the diet is also mandatory. Depending on the conditions, the dose can be increased up to the 10 mg. Now, moving to the toxicity. Till now, no hard and fast amount of toxicity of dapagliflozin is reported. In the experimental trials, from a range of 0.1 milligram to 1500 milligram is administered, but it didn't show any toxicity effects. But here are some important cases which are kept in view, which should be kept in view while using the dapagliflozin. During the first trimester in the pregnancy, dapagliflozin is safe to use, while in the experimental studies during the second and the third trimester, dapagliflozin was also excreted in the mother milk, which the baby consumed, and it resulted in the renal pelvic dilation. Now moving to the contraindications and the food interactions. As we know that the normal renal filtration rate is 90 120 ml. So it shouldn't be given in the persons with lower than 35 ml per minute glomerular filtration rate. It will be contraindicated in them. Also, during the use of the dapagliflozin, alcohol shouldn't be consumed in very large quantities. Adverse effects. Adverse effects of the dapagliflozin are the hypotension, ketoacidosis, very low blood glucose level, acute kidney injury, and impairment in the renal function. It can also result in the bladder cancer and urinary tract infection. Moving to the side effects. The side effects of the dapagliflozin is dizziness, weakness, tiredness, frequent or the painful urination with a burning sensation. You can also get strong smelling urine and decrease in amount of urine. And furthermore, all the signs which are related to the dehydration can be seen in patients suffering from the side effects of the dapagliflozin. Now moving to the interesting information. What is interesting in the dapagliflozin? In the experimental studies, when dapagliflozin was being administered in patients, it was seen that at the end of the 12th week, with the 10% dosage forms, this drug excreted about 70 grams of the glucose in a single day from a person. And when this medicine was discontinued, the glucose excretion rate returned to the normal. Recent searches from onward to 2023, we can say that it is frequently studied as a medicine to treat renal diseases and the disease related to the heart, especially in the hypertension. It can be used to reduce the blood volume, which can reduce the blood pressure. Breast cancer and bladder cancer is also being reported after use of the dapagliflozin. It in a recent study, we can say that about 4,000 people were given the dapagliflozin and 4,000 people were kept on the placebo effect. Out of these 4,000 person on placebo, about 0.03% get the cancer, while in the use of the dapagliflozin, about 15 to 20% out of 4,000 get the breast and the bladder cancer. Thank you. This was all about the dapagliflozin.